Resistance training concepts. The purpose of this presentation is to provide the health and fitness professional with the fundamental concepts related to resistance training. This presentation will also allow the health and fitness professional to select and administer the appropriate resistance training protocol for all clients. Following this presentation, the participant will be able to describe the stages of the general adaptation syndrome, define and describe the principle of specificity, and list and define the various stages of strength and training systems. Traditionally, the resistance training portion of an exercise program is generally seen as the most important. However, it should be very evident by now that without a proper assessment and flexibility protocols and attention to the client's goals, resistance training can become more of a hindrance than a help. There's quite a bit of information that a health and fitness professional needs to review in order to create and understand an effective resistance training program. The following modules will explore many concepts in resistance training as well as address many misconceptions. They will focus on adaptations, progressive strength adaptations derived from resistance training, training systems used to acquire strength, and specific resistance training exercise progressions. Adaptation. There are many important training principles that a health and fitness professional must understand. The most important, perhaps, is that of adaptation. The desire to seek an adaptation is the driving force behind most clients and training programs. Whether the goal is cosmetic in nature, health, or performance-related, resistance training has been shown to produce many desirable effects, including improve cardiovascular efficiency, increase lean body mass, decrease body fat, increase metabolic efficiency, increase tissue tensile strength, increase bone density, and improves endocrine and serum lipid adaptations. The kinetic chain seeks to maintain a state of physiological balance or homeostasis. In order to do this, it must be able to adapt to stresses placed upon it. This ability to adapt to stress is known as the general adaptation syndrome. 3 stages of response to stress include the alarm reaction, resistance development, and exhaustion stage. The alarm reaction is the initial reaction to a stressor. It allows for the activation of protective processes within the body. For example, a person who decides to begin resistance training places his or her body under the stress of increased amounts of force on his or her bones, joints, muscles, connective tissues, and nervous system. This creates a need for increased oxygen and blood supply to the right areas in his or her body, as well as an increased neural recruitment to the muscles. During the resistance development stage, the body increases its functional capacity to adapt to the stressor. After repeated training sessions, the kinetic chain will increase its capability to efficiently recruit muscle fibers and distribute oxygen and blood to the proper areas in the body. Prolonged stress, or stress that is intolerable, will produce exhaustion or distress to the system, the exhaustion phase. When the stressor is too much for the system to handle, it causes a breakdown or injury such as stress fractures, muscle strains, joint pain, emotional fatigue. This is the prime rationale for utilizing the OPT model, a systematic progressive training program that is based on science and proven through application. Resistance training, and any other form of training, must be cycled through different stages that increase stress placed on the kinetic chain and also allow for sufficient rest and recuperation. There are many different tissues in the body, such as muscle fibers and connective tissue, and each have a different adaptive potential to stresses. This means that training programs should provide a variety of intensities and stresses to optimize the adaptation of each tissue to ensure the best possible results. Adaptation can be more specifically applied to certain aspects of the kinetic chain depending on the training technique or techniques employed. This is evident by the principle of specificity. The principle of specificity is often referred to as the SAID principle, which stands for Specific Adaptation to Imposed Demands. Essentially, this means that the body will specifically adapt to the type of demand placed upon it. For example, if someone repeatedly lifts heavy loads, that person will produce higher levels of maximal strength. If they lift lighter loads and higher repetitions, that person will develop higher levels of muscular endurance. The degree of adaptation that occurs during training is directly related to the mechanical, neuromuscular, and metabolic specificity of the training program. In other words, the more specifically a health and fitness professional manipulates the exercise routine to meet the actual goal, the greater the carryover the training program will have on that goal. This is a very important concept for the health and fitness professional to understand and implement in their training program. A client must be trained to meet the specific demands of his or her daily life and goal or goals. As an example, imagine this concept were being applied to a client with the goal of body fat reduction. It is understood that, mechanically, the body burns more calories when movements are performed in the standing position versus a seated or lying position with moderate weights. Neuromuscularly, the body burns more calories when more muscles are being used over longer periods of time in unstable yet controllable environments. Metabolically, the body burns more calories when rest periods are controlled in order to minimize full recuperation. Following these specificity guidelines, this client should then perform more of the exercises in a standing position with moderate weight. The client should also recruit and use more muscles on each exercise when standing versus sitting, while metabolically monitoring rest periods. This method will get the client to effectively burn more calories and achieve the goal of body fat reduction. The concept of adaptation makes it clear that some type of change will occur based upon the stresses placed on the body. Resistance training programs are designed to produce changes that result in various strength adaptations. Following the concepts of the general adaptation syndrome and the principle of specificity, a health and fitness professional can plan the appropriate fitness, wellness, and/or performance program for their client. So, with that said, let's now look further into the different progressive strength adaptations and how they relate to the OPT model. Strength is the ability of the neuromuscular system to produce internal tension in the muscles and connective tissue that pull on the bones to overcome an external force. Strength adaptations obtained from resistance training can be divided into three main categories of stabilization, strength, and power as seen in the OPT model. Each adaptation can be defined by the emphasis that is placed on the neuromuscular system, and all occur in a progressive sequence: stabilization before strength, strength before power. Adaptations for the stabilization level. The first adaptation we'll review is the adaptation of stabilization. This is the desired adaptation when performing resistance training in the stabilization level, or Phase 1 of the OPT model. Stabilization must be established prior to training for other adaptations because it specifically focuses on the recruitment of tissues in the body responsible for postural stability. The emphasis is placed on the nervous system in this adaptation category. Initial gains that are noted in strength originate from within the nervous system. For muscles to function properly, they must be appropriately linked to the nervous system by motor units. By focusing on high repetitions with low intensities at slow velocities, a beginning client can be taught precise exercise technique and establish the right connection between the brain and muscles without placing improper stresses on the body. The two primary adaptations that are achieved in this period of training are muscular endurance and stability. Thus, the reason why Phase 1 of the OPT model is entitled Stabilization Endurance Training. Both of these adaptations increase the ability of the body to produce internal tension and, as a result, increase specific forms of strength for each client. These two adaptations are defined as follows. Muscular endurance is the ability to produce and maintain relatively low levels of force over prolonged periods of time. Stability is the ability of the kinetic chain stabilizing muscles to provide optimal dynamic joint stabilization and maintain correct posture during all movements. This requires high levels of muscular endurance to allow for optimal recruitment of prime movers, increasing force production and force reduction. Stability is arguably the most important adaptation because it increases the ability of the kinetic chain to stabilize the lumbopelvic hip complex and joints during movement to allow the arms and legs to work more efficiently. To accomplish this, the resistance training exercises used in this level of training would be performed in more unstable yet controllable environments. Let's review some example resistance training exercises that would be appropriate to incorporate in the stabilization level of training. Keep in mind, some of these exercises may not be appropriate for individuals who are extremely deconditioned and have extremely poor stabilization control. Thus, we'll also provide some suggestions on how to regress the exercise to make it easier to perform and maximize effectiveness. Starting with total body stabilization exercises. The first example would be a ball squat, curl to press. Make sure both feet are hip to shoulder width apart and that the toes are pointed straight ahead. Also make sure the knees stay in line with the toes. Keep the gluteals activated and the navel is drawn in at all times. To progress the exercise, one can perform the pressing component using alternate arms and then one arm. To regress the exercise, simply decrease the range of motion of the squat. A second example would be a multiplanar step-up, balance, to overhead press. As with the previous exercise, make sure the foot stays straight and the knee stays in line with the toe, both when stepping onto the box and off. Keep the gluteals of the balance leg contracted to ensure optimal control. As a progression, one can perform in the frontal plane, setting up from the side, and the transverse plane, or turning onto the box. To regress this exercise, omit the balance component. Next, we'll review example chest stabilization exercises, starting with ball dumbbell chest press. To maximize stability, make sure the gluteals remain activated and the navel is drawn in at all times. The feet should be positioned hip-width apart, and the shoulders, hips, and knees should remain in alignment. Don't allow the hips to drop towards the floor. Lastly, make sure the individual is positioned on the ball so their head rests comfortably on the ball. As a progression, one can perform this exercise using alternating arms and then one arm. As a regression, this exercise may need to be performed on a bench first, then progress to the ball. The second exercise example would be a push-up. Make sure the individual maintains ideal alignment. The ankle, knee, hip, shoulder, and ear are in line. Maintaining the drawing in maneuver is crucial with this exercise. Don't allow the stomach to drop towards the floor or any drooping of the low back, as this indicates poor intrinsic stability. If this occurs, regress the exercise by having them perform the exercise on their knees or placing their hands on a bench. To progress the exercise, increase the stability requirements by placing their lower extremity on a stability ball. Next, we'll review example back stabilization exercises, starting with a standing cable row. To ensure proper shoulder mechanics, initiate the movement via scapular retraction and depression. Make sure the shoulders do not elevate and that the head does not migrate forward. Keep the navel drawn in and don't let the low back arch. This exercise can be progressed by alternating arms or performing with one arm. As a regression, perform the row in a seated position. The second example is a ball dumbbell row. Make sure the ankle, knees, hips, shoulders, and ears stay in alignment. Instruct the individual to pull their navel away from the ball to maintain core stability. As with the standing cable row, make sure the low back does not go into hyperextension and that the shoulders do not elevate. Also make sure the head is in a neutral position and does not drop towards the floor. Next, we'll review example shoulder stabilization exercises, starting with a single leg dumbbell scaption. Keep the gluteals of the balance leg activated and the navel drawn in. To ensure optimal shoulder mechanics, the arms should be raised at a 45-degree angle with the thumbs up. Do not allow the shoulders to elevate or the head to migrate forward. To progress the exercise, one can alternate the arms or perform with one arm. To regress the exercise, simply omit the balance. The second example is a seated ball overhead press. Keep the feet hips width apart and the toes pointed straight ahead. Keep the navel drawn in to maintain lumbar stability. Don't let the low back arch. As with the dumbbell scaption, keep the shoulders level, no elevation, and a neutral cervical spine, no forward head migration. To progress this exercise, perform using alternating arms to one arm. To regress, perform sitting on a bench. Next, we'll review example bicep stabilization exercises, starting with a single-leg dumbbell curl. To maximize stability, keep the gluteals of the balance leg activated and keep the navel drawn in. Also keep the scapulae retracted for optimal stability of the shoulder girdle. To progress the exercise, alternate arms and then perform with one arm. To regress, simply omit the balance. The second example is a single leg barbell curl. As with the previous exercise, make sure the shoulders stay retracted to ensure optimal shoulder stability. Do not arch the low back when curling the bar. Keep the core stable. To progress this exercise, one may perform in a more unstable environment, such as a half foam roll. To regress, simply omit the balance. Next, we'll review example tricep stabilization exercises, starting with a supine ball tricep extension. Make sure the gluteals remain activated and the navel is drawn in at all times. The feet should be straight and positioned hips width apart. The shoulders, hips, and knees should remain in alignment. Don't allow the hips to drop towards the floor. Make sure the elbows are positioned above the shoulder and maintain that position throughout the exercise. Also make sure the individual is positioned on the ball so their head rests comfortably on the ball. As a progression, one can perform this exercise using alternating arms and then one arm. As a regression, this exercise may need to be performed on a bench first and then progress to the ball. The second example is a prone ball dumbbell tricep extension. Make sure the ankle, knees, hips, shoulders, and ears stay in alignment. Make sure they're looking down to the floor and not in front of them. Instruct the individual to pull their navel away from the ball to maintain core stability. Keep the scapulae retracted to ensure shoulder stability. As a progression, one can perform this exercise using alternating arms and then one arm. As a regression, perform standing with a cable. Lastly, we'll review example leg stabilization exercises. The first example is a ball squat. Make sure both feet are hip to shoulder width apart and that the toes are pointed straight ahead. Also make sure the knees stay in line with the toes throughout the squat. Instruct the client to sit back as if they were sitting into a chair. Keep the gluteals activated, and the navel is drawn in at all times to maximize stability. To progress the exercise, perform the squat without the ball. To regress, decrease the range of motion of the squat. The second example is a step up to balance. As with the ball squat, make sure the foot stays straight and the knee stays in line with the toe, both when stepping onto the box and off. In the balance position, make sure the gluteals of the balance leg are contracted to ensure optimal control. As a progression, one can perform in the frontal plane, or setting up from the side, and the transverse plane, or turning onto the box. To regress this exercise, simply omit the balance component. Adaptations for the strength level. Now we'll look at the adaptations for the strength level, or phases 2, 3, and 4 of the OPT model. The adaptations seen at this level provide the necessary progression from the stabilization adaptations of training to increase the stress placed upon the body, allowing for new adaptations to be achieved. The emphasis in this adaptation category is on both the nervous and muscular systems. Heavier weights and higher volumes of training are used to increase the recruitment, synchronization, and the firing rate of motor units, while placing necessary mechanical stress on the muscles to increase their size and/or strength. Strength endurance, hypertrophy, and maximal strength are the primary adaptations seen in this period of training. We'll first start with strength endurance. Strength endurance is the ability to repeatedly produce higher levels of force for prolonged periods of time. Whereas muscular endurance involves lower intensities of force being used with higher repetitions, 12 to 25, and minimal rest between sets, strength endurance allows the body to use higher levels of force with lower repetitions, 6 to 12, and more sets repeatedly with minimal rest. This adaptation is often trained with the use of supersets and will be discussed further in the program design lesson. This is the primary adaptation goal for Phase 2 of the OPT model, strength endurance training. Hypertrophy is the enlargement of skeletal muscle fibers in response to increased volumes of tension, as seen in resistance training. Muscle hypertrophy is characterized by the increase in the cross-sectional area of individual muscle fibers and is believed to result from an increase in the myofibril proteins. Muscle fibers must be recruited in order to induce hypertrophy. The nervous system must establish the proper connection to effectively communicate with each muscle fiber. This provides the necessary rationale as to why clients should start and revisit the stabilization level of training before entering into the strength level, as the training performed in the stabilization level enhances the neuromuscular connection. This is the primary adaptation goal for Phase 3 of the OPT model, hypertrophy training. The last adaptation in the strength level is maximal strength. Maximal strength is the maximum force that a muscle can produce in a single voluntary effort regardless of how fast the load moves. In order for a muscle to produce maximal force, all of the muscle's motor units must be recruited. Maximum strength can be improved through stabilization training. As mentioned earlier, stabilization training improves the ability of the neuromuscular system to better recruit motor units within a muscle and in synergy with many other muscles. This allows the nervous system to appropriately use muscles to stabilize a joint while other muscles are lifting maximal loads. This is the primary adaptation goal for Phase 4 of the OPT model, maximal strength training. Let's next review some example exercises that would be appropriate to incorporate into the resistance training portion of the program for this level of training. As you'll see, the exercises used in this level of training would be performed in more stable environments to maximize recruitment of the prime movers, versus more unstable environments as seen at the stabilization level. Starting with total body strength exercises. The first example would be a lunge to overhead press. Make sure that both the front and back foot remain straight and that the knee tracks in line with the foot. Make sure the low back does not arch during the pressing portion of the movement, and that the individual maintains the drawing in maneuver. A second example would be a squat curled to overhead press. The feet should remain straight, with knees tracking in line with the toes. To ensure optimal lower extremity in mechanics, make sure the individual sits their hips back as if sitting into a chair. Keep the navel drawn in for proper lumbar stability. As with the previous exercise, make sure the low back does not arch during the pressing portion of the movement. Next, we'll review example chest strength exercises, starting with flat dumbbell chest press on a bench. Make sure that the individual does not arch their back away from the bench during the movement and that the head stays in contact with the bench. Perform the exercise within a range of motion that the individual can control the load without compensation. Although in a more stable environment, keep the navel drawn in for optimal lumbar stability. The second exercise example would be a bench press. Like the dumbbell chest press, make sure the low back does not excessively arch away from the bench and that the cervical spine stays in a neutral position. Also make sure the lower extremity maintains ideal alignment. Feet hips width apart, toes pointed straight, knees in line with the toes. Control the barbell to the chest versus bouncing the bar off the chest. Next, we'll review example back strength exercises, starting with a seated cable row. To ensure proper shoulder mechanics, initiate the movement via scapular retraction and depression. Make sure the shoulders do not elevate and that the head does not migrate forward. Keep the navel drawn in and don't let the low back arch. Also, keep the torso upright throughout the exercise to minimize momentum and to maximize latissimus dorsi recruitment. The second example is a seated lat pull-down. Initiate the movement by retracting and depressing the scapulae. Do not allow the shoulders to elevate when pulling the bar down to the chest. The individual should lean back slightly from the hips to align the fibers of the latissimus dorsi with the resistance, but make sure the individual does not arch their low back. It should remain neutral. The head should also remain in a neutral position and should not migrate forward. As with the row, the torso should also remain stationary throughout the exercise to decrease momentum and maximize latissimus dorsi recruitment. Next, we'll review example shoulder strength exercises, starting with a seated dumbbell shoulder press. Keep the navel drawn in and do not let the low back arch. Make sure the head stays in a neutral position and does not migrate forward. Also, watch to make sure the shoulders do not elevate during the pressing portion of the movement. The second example is a seated shoulder press machine. As with the dumbbell shoulder press, keep the navel drawn in to maintain lumbar stability. Do not let the low back arch. Keep the shoulders level, no elevation, and a neutral cervical spine, no forward head migration. Also be aware of the alignment of the lower extremity, feet straight and hips width apart. Next, we'll review example bicep strength exercises, starting with a seated dumbbell curl. Keep the scapulae retracted for optimal stability of the shoulder girdle. Do not allow the shoulders to elevate or roll forward. Also make sure the back does not arch as the weight is being curled. The spine should remain in a neutral position and the drawing in maneuver maintained. The second example is a barbell curl. Keep the scapulae retracted and do not arch the back when curling the bar up towards the chest. Keep the shoulders level and make sure they don't elevate. To decrease stress on the elbow, do not grip too close or too wide on the bar. Grip the bar roughly shoulder width apart. Next, we'll review example tricep strength exercises, starting with a cable press down. Keep the scapulae retracted to ensure proper shoulder girdle stability. Do not elevate the shoulders. Don't allow the shoulders and spine to flex forward. Maintain the drawing in maneuver and keep the elbow, shoulder, and ear in line throughout the movement. The second example is a supine bench barbell tricep extension. Make sure the feet are hips width apart and stay straight. Maintain the drawing in maneuver to ensure optimal core stabilization and that the low back does not arch away from the bench. While performing the movement, make sure there is not excessive motion, flexion, or extension at the shoulder joint. The elbows should start over the shoulder joint and stay in that location throughout the exercise. Lastly, we'll review example leg strength exercises. The first example is a barbell squat. Make sure both feet are hip to shoulder width apart and that the toes are pointed straight ahead. This will ensure proper neuromuscular efficiency and arthrokinematics. Also make sure the knees stay in line with the toes throughout the squat. Instruct the client to sit back as if they were sitting into a chair. In the lowered position, the tibia should be parallel to the torso. Keep the gluteals activated and the navel drawn in at all times to maximize stability. Only go down as far as one can control without compensation, such as rounding or arching of the lumbar spine. The second example is a leg press. Make sure the feet are straight and placed in the middle of the platform, roughly hip to shoulder width apart. The knees should remain in line with the toes throughout the process. Watch for excessive flexion at the lumbar spine as the weight is lowered. Only go down as far as can be controlled without compensation. Adaptations for the power level. Lastly, we'll review the adaptations for the power level, or Phase 5 of the OPT model. Power is the ability of the neuromuscular system to produce the greatest possible force in the shortest possible time. This is represented by the simple equation of force multiplied by velocity. An increase in either force and/or velocity will produce an increase in power. Power is achieved by increasing the weight, or force, and/or the speed at which a weight is moved, or velocity. This phase of training and the appropriate types of exercises for this phase of training will be discussed further in the program design lesson. Let's review some exercises that would be appropriate at this level of training. Starting with total body power exercises. The first example would be a 2-arm push press. During the pressing motion, the back leg should be in triple extension, plantar flexion, knee extension, hip extension, with the front leg slightly flex. Also make sure that the low back does not arch during the pressing phase. Maintain the drawing in maneuver to ensure optimal stabilization of the lumbar spine. A second example would be a barbell clean. Feet should remain straight with knees tracking in line with the toes. To ensure optimal lower extremity and mechanics, make sure the individual sits their hips back as if sitting into a chair. Keep the navel drawn in for proper lumbar stability. Next, we'll review example chest power exercises, starting with the 2-arm medicine ball chest pass. Push and release the ball toward the wall or partner as hard as can be controlled. Do not allow the shoulders to elevate or the head to migrate forward. Keep the spine stable and do not allow for any excessive spinal flexion. All of the motion should come from the upper extremities. The second example is the rotation chest pass. Use the abdominals and gluteal muscles to rotate the body explosively toward the wall or partner. As the body rotates to release the ball, pivot the back leg and allow it to go into triple extension, plantar flexion, knee extension, and hip extension. As with the 2-arm medicine ball chest press, do not allow for any excessive spinal flexion. Keep the shoulders level and the head neutral. Next, we'll review example back power exercises, starting with a soccer throw. This exercise will require ample amounts of flexibility through the latissimus dorsi to ensure proper mechanics. Make sure that as one raises their arms overhead, that they do not excessively extend their lumbar spine. Keep the navel drawn in at all times for proper stability through the spine, maximizing force production. A more advanced version of this exercise would be to perform a similar motion supine on a stability ball, as seen in your textbook entitled A Ball Medicine Ball Pullover Throw. The second example is the woodshop throw. This exercise challenges force production in the frontal and transverse plane motion. As with the soccer throw, make sure that as one raises their arms overhead, they do not excessively extend their lumbar spine. The shoulders should remain level and the head neutral. Next, we'll review example shoulder power exercises, starting with the medicine ball scoop toss. Make sure that one does not elevate the shoulders or allow the head to migrate forward. This will negatively affect the mechanics of the shoulder joint while adding stress to the joints of both the shoulder girdle and cervical spine. The second example is the side oblique throw. As with the scoop toss, make sure that the shoulders do not elevate or the head migrates forward. To make the exercise more dynamic, have the individual stand upright while rotating the back leg into triple extension when tossing the medicine ball. Lastly, we'll review example leg power exercises, starting with squat jumps. Sit back into the squat while making sure the feet and knees remain straight. The feet and knees should remain straight both before jumping and during the landing. Land on the mid-foot, directly behind the ball of the foot. This will ensure proper force distribution throughout the tissues of the foot and lower extremity. Repeat the movement as quickly as can be controlled. The second example is the tuck jump. The mechanics of this exercise are very similar to that of the squat jump, except you're bringing your knees up towards your chest. Keep the feet and knees straight and land softly on the midfoot. Repeat the movement as quickly as can be controlled. Resistance training systems. Now that we've reviewed the different phases of the OPT model, the desired adaptations for each phase, and some example exercises that can be used at each level of the model, let's review some different training systems that can be implemented for these phases of training. There are many training systems that can be utilized to structure a resistance training program for different effects. We'll review several of the most common training systems that are currently used in the fitness industry, including the single set system, multiple set system, pyramid system, superset system, circuit training system, peripheral heart action system, split routine system, and vertical and horizontal loading. The single set system is one of the oldest training methods. The single set system entails performance of one set of each exercise. Although multiple set training is promoted as being more beneficial for strength and hypertrophy gains in advanced clients, the single set system has been shown to be as beneficial for a beginning level client. In fact, most first-time clients should follow a single-set program to allow for proper adaptive responses of the connective tissue and nervous system prior to engaging in more rigorous training systems. The multiple-set resistance training system has been popular since the 1940s. The multiple-set system of training consists of performing a multiple number of sets for each exercise. Multiple set training can be appropriate for both novice and advanced clients, but has specifically been shown to be superior to single set training for the advanced client. The pyramid system involves a progressive or regressive step approach that either increases weight with each set or decreases weight with each set. In the light to heavy system, the individual performs 10 to 12 repetitions with a light load and increases the resistance for each following set until the individual can perform 1 to 2 repetitions, usually in 4 to 6 sets. The heavy to light system works in the opposite direction. The individual begins with a heavy load following a warm-up for 1 to 2 repetitions, then decreases the load and increases the repetitions for 4 to 6 sets. The superset system utilizes a couple of exercises performed in rapid succession of one another. This system features the use of independent subsystems with similar principles, namely compound set and tri-set systems. Compound sets involve the performance of 2 exercises for antagonistic muscles. For example, an individual may perform a set of bench press followed by cable rows. Tri-sets use 3 exercises in rapid succession for the same muscle group or body part. For example, an individual may perform incline dumbbell press, cable chest press, and push-ups all in succession. The circuit training system consists of a series of exercises that an individual performs one after the other with minimal rest. Circuit training is ideal for those with limited time and those who want to alter body composition. An example may include starting with push-ups, then going immediately to a standing cable row, to a shoulder press, to standing dumbbell curls, to tricep press-downs, to step-ups, and then resting before repeating the circuit. If you are a beginner, you may only go through the circuit once. If you are more intermediate to advanced, you could go through the circuit 2 to 3 times. The peripheral heart action system is another variation of circuit training that alternates upper body and lower body exercises throughout the circuit. This system is very beneficial for incorporating an integrated multi-dimensional program and for altering body composition. Here's an example utilizing each of the different levels of the OPT model within each set of the circuits. Set 1 would include less stable yet controllable stabilization-oriented exercises, starting with a ball dumbbell chest press, then to ball squat, then to standing cable rows, then to a step up to balance, then to a seated ball dumbbell shoulder press, and then rest. The second circuit would include more stable strength-oriented exercises, starting with a bench press, then to barbell squats, then to seated rows, then to a leg press, then to a seated bench dumbbell shoulder press, then rest. The last circuit would include more explosive power-oriented exercises, starting with a medicine ball chest pass, then to a squat jump, then to a wood chop throw, then to a power step-up, then to a side oblique throw, and then rest. A split routine system involves breaking the body up into parts to be trained on separate days. Many bodybuilders, mass-dominant and strength athletes, football, shot put, etc., use the split routine system. Split routines come in all sizes and shapes, from 2-day split routines to 6-day split routines. Any derivative of these outlined routines can be used. The important issue with some of these routines is recovery time. When training each body part more than once a week, volume and intensity should be accounted for. Vertical loading is a resistance training program used by NASM and follows the OPT model. It progresses a workout vertically from the upper extremities to the lower extremities. In a vertically loaded workout, the client would perform the first exercise, total body, for the required repetitions and then move to the chest exercise for the next set of repetitions. After the chest exercise, the client would move on to the back exercise and so forth until all exercises have been completed. Once completed, the client would then start back at the first exercise, total body, and run through the exercises again for the desired amount of sets. This can also be done in a circuit style by minimizing the rest periods in between exercises. Horizontal loading refers to performing all sets of an exercise or body part before moving on to the next exercise or body part. For example, if performing 3 sets of a chest exercise and 3 sets of a back exercise, the client would perform all 3 sets of the chest exercise before moving on to the back exercise. The drawback to the horizontal loading system is the amount of time typically spent resting, which can often add up to more time than the actual workout itself. In summary, a well-designed, integrated training program produces optimum levels of strength, neuromuscular control, power, flexibility, endurance, and alterations in body composition. To achieve this, the body is required to adapt to specifically imposed demands and stresses. The ability to adapt to stress is known as the general adaptation syndrome. There are 3 stages of response to stress. 1. Alarm reaction, or initial activation of protective processes within the body. 2. Resistance development, or an increase in the functional capacity to adapt to a stressor. And 3. Exhaustion, or stress that is too much for the system and causes an injury. To avoid injury, adaptive programs must use a planned training methodology or periodization that cycles through different stages and allows for sufficient rest and recuperation. Training adaptations can be divided into 3 main categories that are consistent with the OPT model: stabilization, strength, and power. Stabilization adaptations should be the beginning point for all first-time clients. Use high repetitions with low to moderate volume and low to moderate intensity in a postural position that challenges the stability of the body. The two primary adaptations that are achieved are muscular endurance and stability. Strength adaptations should utilize low to moderate repetition schemes with moderate to high volume and moderate to high intensity. Heavier weights and higher volumes of training are used to improve the function of motor units, while placing stress on the muscles to increase size and/or strength. Strength endurance, hypertrophy, and maximal strength are the primary adaptations seen in this period of training. Power is the ability of the neuromuscular system to produce the greatest possible force in the shortest possible time. An increase in either force or weight and/or velocity or speed with which weight is moved will produce an increase in power. In order to maximize training for this adaptation, both heavy and light loads must be moved